Sani Bonani, it's Michelle, Nurse Michelle, I guess. I'm back in Salt Lake now, as you can probably see. Well, you can't see outside. But anyways, the whole team made it back home. I'm not sure if some of you guys or not that are going to be watching this were in the medical conference, but these questions are the questions that you guys asked me during the medical conference. The first questions that I'm going to go over are the questions from last year. And then if we have time on this video, we'll go through the ones from this year. If not, we'll send you another video that you guys will watch. But I wanted to kind of catch us up from the questions that you guys had first. So first question was, what do I do if my tongue is being burnt by hot water or tea? So this one, I'm not going to lie, made me chuckle a little because I really didn't know how to answer this. And I know this is really hard that we can't have the back and forth like we did during the medical conference. So the first suggestion that I put is wait until it cools to drink it so you don't make your mouth burn. So I thought that was kind of funny, but then I was like, maybe don't make your drink so hot. But then I also thought maybe this question might be like after you drink something and you get like a burn in your mouth and it's kind of sitting there and for a few days your mouth is kind of sore. So I kind of thought about that as well. So maybe if you do drink something that's hot and you do burn your mouth, then just wait and it'll heal within a few days. Try not to eat anything hard like chips. Eat soft foods so you don't irritate that burn that's in your mouth. So I hope all these answer your questions. If not, we will figure out how to go back and forth to make sure that you guys are informed about all these things. So the next one was, what causes heartburn? So that's a really hard question because heartburn can be caused by a lot of things. Some of the things that I put on here is eating an unhealthy diet. So chips, cookies, fried food, sugar, coffee, and soda can all cause heartburn. So obviously I keep telling you guys this over and over again. Try to eat more fruits and vegetables, water, and exercise. Now, you all walk a lot, and that is great exercise, but do intentional exercise. So like for 30 minutes, walk really fast. So that's what I mean when I say do exercise. And then also another thing, which this happens to me when I'm at work, I pretty much always get heartburn, and it's because of stress. So stress can also cause heartburn as well. So when you're feeling that heartburn, and let's say you're in a stressful environment, try to take some deep breaths and try to calm down a little bit. Drink some water, not a soda, and hopefully maybe that can alleviate some of those symptoms. The next one was another really hard one to ask because, again, there's a lot of things that can cause this, but what causes my feet to swell and have pain? So is this a female or a male? Is the big question that I put on here. Like if it's a female and you're not pregnant, this could be standing from too long, an unhealthy diet, or you might have actually high blood pressure if you're older. If you're a female and you're pregnant, it could just be because of pregnancy. So the big thing to do is kind of realize that you're swelling and maybe try to take some rest. So if you can, when your feet start to swell and you're hurting really bad, sit down in a chair and elevate your feet for maybe 5 minutes and see if that will kind of relieve some of that pressure that you're feeling from the swelling. Maybe if you can, have somebody check your blood pressure or go to the clinic and see if you could get a blood pressure taken to see if you actually have high blood pressure, because sometimes your feet swell when you have high blood pressure too as well. And then try to make sure that your shoes are the right size. Sometimes if your shoes are too tight, that can cause swelling too as well. And then if you do have to stand for long periods of time during the day, then just try to wear very, very comfortable shoes and not high heels. If you're a woman, wear sneakers. Some of the other questions that I got. Can a broken bone fully recover if the patient is taken to the hospital? And I said, yes, it can heal. And then I put on here, because I did some research for you guys, bones need time to grow back together, which can take up to 6 to 12 weeks. And that's when that bone is splinted or immobilized and not moving. Maybe you might even see them put it in a cast. Then it is strong enough to have the splint or cast taken off, but the bone will still be very weak, very sore. You might even notice some swelling at the end of the day where that fracture was as well. And that takes over a year to recover fully from that fracture. Next one is, can eggs help on burns? And what I put is, if you do not have access to the clinic or the burn ointment that I put in your all of your first aid kits, or clean water, then an egg white might help. But again, please try to do the things that we taught you. So you can, if you don't have access to the clinic, you don't have any more burn cream, you don't have any clean water available, you can use an egg white and it could help. And I know that's something that's been done for generations. So if you feel comfortable doing that and you've noticed that it does work, then go ahead and do it. But do the things that we taught you too, or at least try to do the things that we taught you in the medical conference. How can I help a person who gets unconscious and it can be caused by shock or somebody hit you really badly? So this question was kind of worded funny, or not really funny, but just hard for me to understand. So again, this was from last year, so hopefully I can help you understand this. So if they are unconscious, meaning you cannot wake them up, and they are not breathing, then you must go to the hospital. This is an emergency. If they are breathing and you can wake them up, then just watch them and make sure they're getting better after the injury. So kind of what I understood that question to be is somebody that gets hit really bad and then they're knocked out unconscious. Sometimes they can be knocked out and in a few minutes, they should wake up. If they don't wake up within a few minutes, then I would go ahead and start calling for help to get this person to the hospital or clinic. And then the next question was, a house if on fire and there's a kid inside, how can I get in and rescue that kid or that person? So I said in this answer, I said, unfortunately, I'm not a fire professional. In the States, we have firefighters or fire professionals here in Salt Lake. So I would do the best that you can to be safe and try to rescue. I just do not know much about fires or how they work. And so in a situation like that, obviously in the house, if you hear somebody screaming for help, like I teach you guys in the medical conference, is you don't want to risk yourself helping somebody else, because then you create a bigger problem, because now you have two patients and you don't just have one. So please be very careful on running into a burning house to rescue somebody, and make sure that you're safe, because you have to keep yourself safe first. How to give first aid to, and then it was in quotations, in bleeding when a person has a broken bone, bleeding from the inside, no cut to the elbow, blood out, and blood inside is speeding up, swelling that might look like skin will burst. So that one was kind of hard for me to understand, but what I put together is this is another situation where you would need to go to the clinic. Please do not try to cut the skin and release the pressure or release the blood, because this will cause more injury. The person needs to get an x-ray and see a doctor. So what I understood with that question is somebody has a really bad injury on their arm and you notice the swelling or the blood developing under the skin. To me, that sounds like a really bad bone break or fracture. Remember, fracture and bone break are the same thing. And so they probably need to go to the clinic if you're noticing a lot of swelling. Or like I talked about in the medical training too, this could be a sprain. So it's really good to ask the patient on how this injury happened. Like, were they just sitting in this chair and they just kind of fell off and then they, notice that their arm is really swollen? Because sometimes you can injure yourself and get really bad swelling. Or did they fall from a really high area and now you notice that the area is swelling? Because that could potentially be a fracture or a broken bone. So the big thing to ask first is, how did this happen? and think about the injury and how it happened. If it seems like it was just kind of a minor fall or a minor trip, then maybe it's not something that needs to go to the clinic. And it's one of those things that you just kind of watch and wait and see if it gets better. If it doesn't get better and the swelling gets worse and the pain gets worse, then they might have a fracture that they need to go to the clinic and get an x-ray of their bone. Can an electric blanket cause a fire? And I put yes, absolutely. Anything with electricity running through it can cause a fire. Okay, next question. Once heard on the radio, oh boy, this made me nervous. They said we should exercise by running to increase blood flow / pressure. So that the poison can be mixed with the blood all over the body. Its concentration will be lowered / reduced. In case you are alone or far from home, how true is that? And I have not heard that. And I would follow the directions in the packet I gave out. And I actually Googled, I went to Dr. Google for you guys to see if any of that is maybe something that was even tested here in the States. And I couldn't find any research on that. So I would, again, I really want you guys to use that number for the venomous snake bites that I gave you in the handout this year. And let me know the feedback. Let me know if that number is working. Let me know if they're able to help you or not. Let me know if it's even a thing anymore. Because like I said at the medical conference, I tried to reach out to this company. I didn't hear back from them, so I don't know. But if it is something that's working, I think this would be very beneficial for you guys. Okay, this question was actually asked this year and last year, so I want to cover it pretty broadly. So does methylene spirit disinfect? So we actually don't have methylene spirit in the States, so I had to Google to see what it was. And what it is it's kind of like rubbing alcohol that we use here in the States. But the information that I got online, that it seems like it's pretty dangerous to use. But some of you might have used it before on cuts and wounds. So apart from this fact that methylene spirit, it actually delays wound healing. In the research that I did and did find out about it, it may cause persistent bleeding. So when you use that to clean a wound, it might cause the wound to bleed more. And it also causes a lot of pain when used. So use the instructions that I gave you in the packet that we gave out for cleaning wounds. That clean water will work with the antibiotic ointment that I gave you guys as well in the first aid kits. Is it okay to give water to a bleeding patient? And this depends on how badly they're bleeding. Like, is it just a little, like a minor cut? Then if the bleeding if they are bleeding bad and going in and out of consciousness, no. But if it's just a minor cut, yes, it's fine. If the bleeding is not bad with a dressing on the wound and you are driving to the clinic and the patient is calm and not having any breathing problems, then yes, water is okay in little sips to the patient. But if the cut is really bad and they're going in and out of consciousness and you're driving to the clinic, I wouldn't give the patient any water. But if this is a very minor cut, maybe the patient's kind of hyperventilating a little sips of water can help. But you don't want to give them a lot of water and have them potentially start vomiting too because they're so worked up. This question is about sprains and dislocations. How can you tell the difference as a helper? And that is a great question, but a sprain and a dislocation, both will be very swollen, right? Even a broken bone. Remember, a fracture, sprain, dislocation, like they all swell, that tissue swells. But a dislocation happens in a joint. So a dislocation would be the shoulder, would be the hip, would be the knee, would be the ankle. A joint is an area in the body that can move like this. So you wouldn't see somebody dislocate their arm right here. You wouldn't see somebody dislocate their arm right here, or even their thigh. They would not dislocate their thigh. So a dislocation happens in a joint that's moving. So a sprain can really happen at the joint, but it won't look like it's out of place, if that makes sense. The sprain will just most likely be really swollen. But a dislocation, it's gonna look like out of joint. It's gonna look really wonky, because what's happening in a dislocation is it happens in a joint, and this joint right here, this moving joint, falls out of the socket. So a sprain is, remember, like I talked to you guys in the medical training, is a tendon that tears a little bit. But a dislocation, the joint comes out, and it has to go to the hospital to be put back in. A fracture is where the bone just breaks. So I hope that helps explain that a little bit better. And then here, this is the next question. Here in Eswatini, we used to eat mud, milk, and aloe to prevent snake bites. This is for making or lowers the heart and pumping fast until you seek help. What else can help me as I'm waiting to rush to the hospital, because here they can't meet you if you are far? And I said to keep the patient calm, sit down and rest. The big thing is to keep them taking slow, deep rests while you're trying to take them to the hospital, and keep them calm is the best thing to do. What causes fungal infections during pregnancy? And this one I did a lot of research for you. So during pregnancy, you have an increase in your hormones, and this could be causing the infection, because your hormones, which are in your body that you can't control, are kind of fluctuating different, and so you might have an increase of fungal infections. And then how to treat it. So I would bring this up at one of your doctor visits when you go for a checkup when you're pregnant. If the patient is unable to go to the clinic, they do have over-the-counter medicine that you can get at a pharmacy to treat the fungal infections as well. There is always a pharmacist working behind the counter that you can ask them questions on which cream is safe to buy when you're pregnant. And I would definitely make sure you do that, because there's some things that you can take when you're pregnant and there's some things you can't. So if you go to the pharmacy, there's a pharmacist there working that you can say, I have a fungal infection. Which cream do you recommend that I use if I'm pregnant? Prevention is the key for most of the things that we taught. So here are some tips in trying to prevent the fungal infections from happening. So wear loose-fitting clothing or cotton underwear. Avoid tight jeans and pantyhose, as yeast thrives in moist, warm environments. Avoid vaginal sprays, perfumes, and lotion, which can cause irritation in the vagina and cause an imbalance in bacteria and yeast. Drying the genital area thoroughly after showering or bathing to make sure it's all nice and dry, and reducing the sugar that you eat, which I thought that was pretty interesting. What causes a kid to shake his or her hand when they are sleeping? I did some research because I actually do not know what causes this movement, and neither do doctors. But is it completely normal, and most people do it? So it's just kind of like they're twitching at night and their muscles are twitching and their body's twitching. But I actually went to Google to see if I could find some information, because I thought that was a pretty interesting question too, on why do we twitch when we're sleeping? And I couldn't find any information on it. So I hope this helps. We will go over the second question in another video for you guys. We're gonna figure out also with the team on your side how to do some more of this back and forth. So please let them know what you thought about this and how this worked out for you guys. And I miss you so much, and have a great day. Keep learning, keep asking questions. Bye.